holidays can bring on more than cheer. It sometimes brings on depression. But if you are experiencing depressed moods, it may be the symptom of hypothyroidism. Dr. Stephen Hotze is the founder of the Hotze Health and Wellness Center, and he is here today with great information about treating this type of depression. What is it exactly? What is depression exactly?
Depression is a discouragement, feeling down, feeling blue, sometimes for no apparent reason. It can be involved with mood swings and also be associated with anxiety and panic attacks. Oftentimes we feel depressed for good reasons. A financial strain, loss of a loved one, breakup of a marriage, loss of a job. That's to be expected, and you have to work through that, and there's a grieving process that you need to go through. Oftentimes when people are depressed and they see their physician, they're prescribed antidepressants, which block the natural grieving process and never let you work through it. And as a matter of fact, can have some severe effect on the way you think. But depression, if it's continuous and it's something that lasts over a period of time, oftentimes can be related to a decline in your natural occurring hormones.
See, I'm glad you distinguished that for me, because a lot of times we go through a case of the blues, but how do you know when that case of the blues is something much more? And how do you know if, when your doctor is saying antidepressant, that you really need something else?
Well, oftentimes you got to go with, you go with the recommendations that your doctor says because you're trusting his judgment. Unfortunately, many physicians have been trained by the drug salesmen and their drug reps to use antidepressants. Anytime a woman has a problem or a man has a problem that they can't find a reason on a blood test, routinely they'll give them antidepressants, so that the preponderance of antidepressants are given to women in midlife. And what do women in midlife have that causes them to feel depressed? The decline in their natural occurring hormones, their natural sex hormones, particularly progesterone. And when the progesterone levels fall, guess what? They get too much. They have too much estrogen compared to progesterone, and that adversely affects their thyroid function, which governs their metabolism, which governs their energy production, which affects their brain function, and they feel depressed.
So your recommendation then would be to check the hormone levels before you try the antidepressants.
First, before you check the hormone levels, ask the patient and your patient questions and listen and find out, does she have problems with fatigue, difficulty thinking, depressed moods, can't sleep well, joint and muscle aches and pain, sluggish bowel function, hair falling out, puffy, pale, cold hands, cold feet. Those are all classic, and depression, those are all classical features of hypothyroidism. And so you do a blood test, the blood test comes back routinely, 95% of the cases normal. But if she has all the symptoms of low thyroid, why not, instead of giving her an antidepressant, give her a clinical trial of Armour thyroid to see if that improves her symptoms. And that's safe and effective and doesn't screw up your brain.
Okay, so the Armour thyroid being bioidentical.
It's bioidentical. It's natural. We've only been using it for 100 years in medicine. It's safe and effective.
Okay, all right, very good. So again, I just want to really be sure that we're understanding, because this is that time of the year when
a lot of times we feel that way because we remember mom who died, and this is the first year she's been gone, or dad, and all the loved ones we have. Those are natural feelings, and we don't need to mask those. Those probably are not due to hormones. That's just the way we feel. But as we age, our hormone levels fall, and we tend to get that way. We tend to become more reflective. And if you get your hormone levels back up, you tend to tolerate that better. Doesn't mean you're not going to feel sad, but you bounce out of it.
So look for the multiple symptoms.
Right. The multiple symptoms is what you look for to see if it's more than just depression on its own. If you've got these multiple symptoms, it's probably low thyroid.
The fatigue and the foggy brain.
And inability to lose weight and can't sleep well.
And then the other thing about the antidepressants, doesn't that sometimes cause you to gain weight?
Well, it causes you to gain weight, and guess what? The most common side effect of antidepressant is more depression when the doctor will give you more antidepressants. We hear about all these weird killings that go off across the country. Invariably, those people are on antidepressants because it adversely affects the way they think.
You're giving us a lot to think about. Thank you.
Merry Christmas to you. Merry Christmas to you.
Thank you. For more information about hypothyroidism, log on to Dr. Hotze's website. It's hotzehwc.com, or call his office at 877-698-8698. And you can catch Dr. Hotze's radio show, Health and Wellness Solutions. It runs Monday through Friday from 12 to 1 on 1160 AM KVCE in Dallas.